afternoon, everyone. My name is Laura Morell, and I work in the National Center for Emerging and Zoonotic Infectious Diseases at the Centers for Disease Control and Prevention. On behalf of the One Health Office, I'm pleased to welcome you to the monthly Zoonoses and One Health Updates call on September 2nd, 2020. Next slide. Although the content of this webinar is directed to veterinarians, physicians, epidemiologists, and related public health professionals in federal, state, and local positions, the CDC has no control over who participates. Therefore, please exercise discretion on sensitive content and material, as confidentiality cannot be guaranteed. Today's webinar is being recorded. If you have any objections, you may disconnect now. Next slide. Today's presentations will address one or more of the following 5 objectives. Describe 2 key points from each presentation. Describe how a multi-sectoral One Health approach can be applied to the presentation topics. Identify an implication for animal and human health. Identify a One Health approach strategy for prevention, detection, or response to public health threats. And identify 2 new resources from CDC partners. Next slide. In compliance with continuing education requirements, all presenters must disclose any financial or other associations with the manufacturers of commercial products, suppliers of commercial services, or commercial supporters, as well as any use of unlabeled products or products under investigational use. CDC, our planners, presenters, and their spouses and partners wish to disclose they have no financial interests or other relationships with the manufacturers of commercial products, suppliers of commercial services, or commercial supporters. The Planning Committee reviewed content to ensure there is no bias. The presentations will not include any discussion of the unlabeled use of a product or a product under investigational use. CDC did not accept commercial support for this activity. Next slide. Instructions for receiving free continuing education are available at cdc.gov/onehealth/zohu/continuing education. The course access code is OneHealth2020. To receive free CE for today's webcast, complete the evaluation at cdc.gov/tceonline by October 12th, 2020. A web-on-demand recording of today's webinar will be posted online at cdc.gov/onehealth/zohu/2020/september.html by October 13th, 2020. To receive free CE for the web-on-demand video of today's webinar, complete the evaluation at www.cdc.gov/tceonline by October 13th, 2022. Next slide. Before we begin today's presentation, Dr. Casey Barton-Baravesh, Director of CDC's One Health Office, will share some news and updates.
Thanks, Laura. Hi, everyone. I hope you're doing well, and thank you for joining us on today's ZOHU call. We appreciate your help in spreading the word about the ZOHU call by sharing the website link with your colleagues from human, animal, and environmental health, as well as other relevant partners. Before our presentations start, I'd like to share a few highlights from today's ZOHU Call email newsletter. If you're not yet subscribed, please use the link at the top of the main ZOHU Call webpage to help you stay informed. CDC's response to the COVID-19 outbreak continues and is rapidly evolving. Please check CDC's website for the latest guidance and resources, including information on how to protect people, as well as about pets and other animals. The One Health Federal Interagency COVID-19 Coordination Group continues to bring representatives from 17 key federal agencies for weekly meetings to share news, key updates, publications, and guidance on the One Health aspects of COVID-19. We also host a weekly state-federal One Health coordination call for state and federal officials to exchange information, as well as a new monthly One Health COVID-19 Partners webinar. At this time, there are 41 confirmed cases of SARS-CoV-2 infection in animals in the United States. Most of these cases have been in cats and dogs, but recently infections in mink were reported at 5 farms in Utah. The list of animals confirmed with SARS-CoV-2 in the United States can be found on the USDA APHIS website. In the United States, there's no evidence that animals are playing a significant role in the spread of COVID-19, and based on limited information available to date, the risk of animals, including pets, spreading COVID-19 to people is considered to be low. But it's important to know if you're sick with COVID-19, you should restrict contact with your pets and other animals, just like you would with people. And always talk to your veterinarian if your pet gets sick or if you have concerns about your pet or other animal's health. Next, CDC is excited to announce that data on 2018 outbreaks reported through the National Outbreak Reporting System, or NORS, are available on the NORS dashboard. Next slide, please. CDC has released the first annual report for the Animal Contact Outbreak Surveillance System, which is the topic of today's first presentation. Next slide, please. You can also check out several upcoming observances of interest. September is Preparedness Month, and we're working to remind folks to get prepared for their families, including pets. And September 28th is World Rabies Day, just to highlight a few. Next slide, please. A new outbreak of Salmonella infections linked to peaches has been posted on CDC's website. Our next call will take place on October 7th. And please email topic suggestions for future presentations and news from your organization to zohucall@cdc.gov, and we're happy to share that. I'll now turn the call back over to Laura. Thanks.
Thank you. Next slide, please. You may submit questions at any time using Zoom's Q&A feature. Please include the topic or presenter's name with your question. The Q&A session will follow the final presentation. Next slide. Our first presentation, Animal Contact Outbreak Surveillance System and the 2017 Surveillance Summary, will be given by Dr. Bridget Gleason. Please begin when you're ready.
Good afternoon, and perhaps good morning to some of you. I'm Bridget Gleason, and I'm the team lead for the National Outbreak Reporting System, or NORS, at CDC. And I'll be speaking about the Animal Contact Outbreak Surveillance System, or ACOSS. And I'll tell you about our first ever surveillance summary for animal contact outbreaks. We just launched a website for ACOSS, which hosts this new surveillance summary, along with several other related resources. So in light of these recent develops, I'm very excited to be able to share this information with all of you on this ZOHU call. Next slide, please. So first, I'd like to share some background information about NORS and what data it collects. So the National Outbreak Reporting System, it's a web-based platform, and it's used by local, state, and territorial health departments in the US to report to CDC all waterborne and foodborne disease outbreaks, as well as enteric disease outbreaks that are transmitted by contact with environmental sources or infected people or animals, or even unknown modes of transmission. So NORS is a reporting platform that's made up of several outbreak surveillance systems, and they cover various modes of transmission. And animal contact is just one of those modes of transmission captured by NORS. So the Animal Contact Outbreak Surveillance System, or ACOSS, is a surveillance system that receives reports through the NORS platform. So ACOSS doesn't capture all animal contact outbreaks. It focuses on domestic outbreaks of enteric illnesses that are associated with animal contact. And NORS has actually been collecting data on enteric disease outbreaks linked to animal contact since 2009, but our team has only recently begun to analyze and share findings about these data on a more routine basis. Next slide. So what do I mean when I say animal contact? NORS defines animal contact as any contact with an animal source. And an animal source could be an animal's body fluids, except for milk and other fluids that are consumed as food, an animal's fur, hair, feathers, scales, or skin, an animal's food, or an animal's environment, which includes places it lives and roams, such as farms, schools, petting zoos, or pet stores. So essentially, this definition captures both direct and indirect contact with animals. All right, now that we know how we define animal contact, what are animal contact outbreaks? So NORS defines an animal contact outbreak as an outbreak where 2 or more people have the same enteric illness and are linked to contact with a common animal source. So for example, if a group of children got sick from salmonella after playing with goats at a petting zoo, that would be considered an animal contact outbreak. And I want to point out that animal contact outbreaks are distinct from foodborne outbreaks, which is why consumption of an animal's milk or any animal food product would not be considered an animal contact outbreak, but instead it would be a foodborne outbreak. And as I mentioned, foodborne outbreaks are one of the other modes of transmission that are captured in NORS. So recall that ACOSS is just one part of NORS. So why does this matter? Why is it important to track these things? Well, really because the more we know about outbreaks, the more we can understand their causes and the various factors associated with them, which can then help us to develop interventions and ultimately prevent people from getting sick. Next slide, please. Okay, so now I want to give a few more details about ACOSS. And as a reminder, animal contact outbreaks are reported into ACOSS through the web-based NORS platform. So what pathogens does ACOSS collect information on? We collect reports on outbreaks caused by zoonotic pathogens that cause enteric illnesses such as Salmonella, Cryptosporidium, Campylobacter, Giardia, and E. coli. So knowing more about enteric disease animal contact outbreaks increases our understanding of these pathogens and their effects on human health. And this knowledge helps in creating more effective outbreak control and prevention measures. Next slide, please. So health departments have been reporting animal contact outbreaks through NORS since 2009. And data from these outbreaks have been included in publications, and some of those data are available online on the NORS dashboard. But ACOSS did not have a dedicated website or associated resources available for public view until this year. So we wanted to make information on animal contact outbreaks easy to access and understand, whether you're a researcher, a healthcare provider, or a student, a concerned parent, or anybody else. So we are excited to announce that the ACOSS website is now available online at cdc.gov/ACOSS. And the website allows viewers to learn more about enteric disease outbreaks caused by animal contact and associated surveillance data through FAQs, background information, and publications that use animal contact outbreak data, such as the 2017 surveillance summary for enteric disease outbreaks caused by animal contact. The ACOSS site also includes a link to the NORS dashboard where users can view, sort, and download a limited data set of animal contact outbreaks reported through NORS from 2009 through 2018. And here users can visualize animal contact outbreak reports by setting, etiology, which we refer to as the causative pathogen, such as Salmonella, type of animal, state, and other variables. So please also note that NORS dashboard does not contain all data reported through NORS. To obtain additional data for a scientific study or analysis, or if you just have questions about how to use or interpret these data, you can contact NORS dashboard at cdc.gov. Next slide. So in addition to the development and launch of the ACOSS website, we're also happy to release the first annual surveillance summary of enteric disease outbreaks caused by animal contact, which covers the year 2017. And we hope to develop annual surveillance summaries from now on, or perhaps multi-year summaries. And this report describes the 59 enteric disease outbreaks caused by animal contact that were reported to ACOSS for the year 2017, and includes information on pathogens, settings, animal types, and other characteristics of these outbreaks. So the report is fully built into the ACOSS website, so you don't have to leave the page or download anything to access it. So whether you're on your computer or your phone or your tablet, it was intentionally developed in a way to maximize accessibility. And I do want to give a shout out to our fantastic comms team for leading that effort specifically. Next slide. So here are a few quick highlights from the 2017 surveillance summary. So 59 enteric disease outbreaks I mentioned, and they resulted in 1,518 illnesses, 312 hospitalizations, and 3 deaths. Next slide. The most common causes of single etiology outbreaks were Salmonella and Cryptosporidium, which accounted for 39 outbreaks, or 66% of all animal contact outbreaks in 2017. Next slide. Livestock and poultry were the most common animal categories implicated in outbreaks, accounting for 40 outbreaks, or 67% of all in 2017. And just want to point out that outbreaks associated with contact with poultry accounted for the most illnesses associated with animal contact outbreaks in 2017, causing 1,149 illnesses, or 75% of them. And what I'm sharing here today, it's really just a teaser almost. So I would encourage you to check out the full surveillance summary on the new ACOSS website to see more. Next slide. So the highlights I shared, along with the rest of the data included in the surveillance summary, emphasize the need to better understand enteric diseases using a One Health approach. So we can use data collected through ACOSS in conjunction with other public health data to detect emerging trends and inform interventions to prevent further illnesses and outbreaks from animal contact. So these data enable us to use the One Health framework to better understand how the health of people is interconnected with animals and the environment. Next slide, which is the last one. So for more information, you can visit the ACOSS, NORS, and One Health websites. And in closing, I'd like to acknowledge Ariana Perez for all of her work on ACOSS and this presentation. And thanks to all of you for listening today. If you have questions, feel free to email norsdashboard@cdc.gov, or you can use the Zoom Q&A feature that you have available today. Thanks so much.
Thank you. Let's go to our next slide. Our next presentation, Rat Bite Fever, is by Rita Traxler. Please begin when you're ready.
Hi, thanks everyone. My name is Rita Traxler. I'm an epidemiologist in the Division of High Consequence Pathogens and Pathology at CDC. And I'll just be talking about rat bite fever in the United States today. Next slide, please. And then next slide. So I'll just be talking about a little bit of background first in rat bite fever, or RBF. So it is caused by Streptobacillus moniliformis, at least in the US. The primary host are rats. These are asymptomatic carriers and can be intermittent shedders in body fluids. There are other secondary hosts, including rodent and non-rodent species, and these may be asymptomatic. They may present as asymptomatic. However, some rodent species may have symptoms as well. Next slide. So transmission to humans of rat bite fever can be through direct contact with animals, including bites or scratches, hence the name, but it can also be through handling of animals without a distinct wound, including kissing a pet rat. And so that can also be a misnomer of the name of the disease. There are also ways through indirect contact, including contact with contaminated surfaces or consuming contaminated food or drinks, which can also be called Haverhill fever. There is no known human-to-human transmission, and this is considered a very rare disease. There is a number that's published in the literature that there's 200 cases that have ever been reported. However, that number hasn't changed in a long time, and no one has done a new lit review to count the new number of cases that are reported in the literature. And then about 7 to 13% of cases are estimated to be fatal. Next slide, please. So diagnostics can be a challenge for this bacterium. Culture is challenging at times because it can be a fastidious organism. Our lab at CDC is investigating ways to improve organism recovery. Serology may be an option at some places. CDC does not offer any serological assays for rat bite fever. And then PCR can also be an option. Next slide. This leads into that there are a number of barriers to identifying and then preventing rat bite fever. So other diseases that may be more common are often on the differential. So if someone is presenting with fever, arthralgia, and a rash, someone may consider something else instead, such as Rocky Mountain spotted fever. And there also are additional diagnostic challenges beyond just lab testing. Clinicians do need to have a high index of suspicion for the pathogen because it is fastidious, and so they need to hold it long enough in the laboratory. And then also because someone may not be presenting with an animal bite, that there could be challenges in even recognizing that that a rat bite had occurred or a rat contact had occurred. And finally, there's also limited surveillance and epi data available. As I'd said, there's limited information in the literature. The literature is quite outdated at this point in time. There's likely a number of misdiagnoses because of the difficulties in diagnostics, and also it's not reportable in the US. So we have looked at our own laboratory data. We have a reference lab, the Special Bacteriology Reference Lab at CDC. And even then, sorry, next slide, thank you. And even then we have, we've only identified 67 isolates since 1961. So it's a very small number. But even then, and looking from these limited data and then from also case reports, we do see anecdotally that cases are often occurring in children. So you can see here, there's about 50% of the cases that we've identified have been in children and teens 0 to 19 years old. But to learn more about the burden and some of the epidemiology of the disease in the US, we did turn to administrative healthcare data at the population level in the US. Next slide. And next slide. So the objectives of the study that we undertook was using ICD-10 discharge records from healthcare encounter data sources. And we were able to describe some limited epidemiology of healthcare visits associated with rat bite fever. This included the number of hospitalizations and emergency department visits, distribution across age groups, and looking at differences across race, ethnicity. Additionally, because of the disease name, that suggests that a bite should occur, and also an old reference that has been continually referenced in the literature, that 10% of rat bites are associated with rat bite fever. We also investigated rat bite fever within the context of rat bite injuries using ICD codes. We did recently publish this work in the Open Forum of Infectious Diseases, and I'll be discussing the findings briefly here as well. Now, using these data, there are a number of limitations. So with any healthcare encounter data or administrative data, including the fact that we're likely missing patients who are misdiagnosed. And these are also not lab-confirmed cases. These are just discharge diagnoses. So we don't know the sensitivity of the codes that we were using. Also, all of these sources that use these visits rather than people, so they're not patient-based, so multiple visits could be counting the same person. Next slide. So these are the data sources that we use. These are all, 4 of these are available through the Healthcare Cost and Utilization Project, or HCUP. So we use the NIST, Nationwide Inpatient Sample, and the Nationwide Emergency Department samples. So both of these are about a 20% sample of visits. And then the SID and KID are 100% of inpatient visits, and then from all hospitalizations in participating states, and the KID is only looking at children's hospital visits. We also used Indian Health Service data that looked at 100% of all visits to Indian Health Service facilities, and these included inpatient, outpatient, and ED visits as well. Next slide. So just going through quickly, for the nationwide inpatient sample, we found 929 rat bite fever hospitalizations from 2001 to 2015. This is an estimate from the sample. And so 52% of these were in 0 to 19-year-olds. The majority were private insurance holders, and the average annual rate that we calculated was 0.2 per 1 million. So this shows it's still a very rare disease. Putting that in context, that's about 65 hospitalizations of rat bite fever in 2018. And in 0 to 19-year-olds, the rate was almost double, so about 0.39 per 1 million. That's about 32 hospitalizations of rat bite fever in 2018. Next slide. And as you can see here, hospitalization rates for injury, which is in the yellow, so this is rat bite fever injuries. that this rose slightly by age group, but these were not statistically significantly different. And then rat bite fever, you can see, is much higher in the 0 to 19-year-old age group, and then fell in the older age groups. And this was a statistically significant difference between those age groups. Next slide. So looking at the emergency department visits, we found 1,033 visits over the time period of 2006 to 2015. This is an average annual rate of 0.33 per 1 million population. And here we found with ED visits, there was an equal proportion of Medicaid and private insurance holders. So it was a bit of a different breakdown for ED visits versus inpatient visits. And then we found that 50% resulted in admission to the same hospital. So people who were presenting to the ED, half of them were hospitalized. Then from Indian Health Service data, we did not identify any hospitalizations. We did find 66 emergency department and outpatient visits. And then we're looking at this over the entire Indian Health Service catchment population. We found that the rate was 3 per 1 million population, so about 10 times higher than for the nationwide sample. Next slide, please. So summarizing these the study conclusions is that this is still a rare disease, but we have a population estimate for the disease rather than using case reports and older literature. We did find that there's a higher rate of hospitalizations in kids and teens, which is, confirming what we've identified in anecdotal reports in the case literature and lab data. We did not find any difference across the age groups for rat bite injury. And there does appear to be some differences in some socioeconomic characteristics, race, ethnicity, and insurance coverage of patients seen for rat bite fever, emergency department visits versus hospitalizations. And this does suggest that there could be some socioeconomic barriers to care. However, we do need to investigate that a lot more to identify what we're actually seeing here. These findings also suggest that there could be a greater vulnerability for American Indian and Alaska Native populations. Although the tenfold increase between the two populations isn't exactly comparable because the AIAN numbers do include outpatient visits as well, whereas the nationwide ED visits do not. Next slide. So what does all this mean and what are our recommendations? I mean, it's still a rare disease. However, we do recommend that clinicians should consider rat bite fever on the differential for patients who have the clinical signs of disease and they have a rodent exposure. And how a clinician could get to that is taking a social history. So of any pet ownership or rodent and other animal contact. And this really would benefit the consideration of any zoonotic condition that can be due to animal contact. We are also aiming to further develop some communication activities and materials for people who do have contact with pet or wild rats, including safe handling messages and disseminating those out. Finally, we are aiming to do some further investigation on possible disparities that we identified from our observations in this study. And then we're also advocating for diagnostic improvements, and the CDC laboratory is working on that right now. Next slide. And I'd like to thank everyone here, as long as all my co-authors on this paper. And next slide, please. And next slide. Thank you. The questions will be at the end, but if you have any, please put them in the Q&A chat. And thank you very much for your time.
Thank you. Our final presentation, a One Health approach to continued surveillance and characterization of zoonotic transmission of SARS-CoV-2 is by Dr. Jessica R. Spangler. Please begin when you're ready.
Hi, everyone, and good afternoon. I'm Jessica Spangler. I'm a veterinary medical officer at the CDC, and I've had been fortunate enough to have the opportunity to contribute to CDC's COVID-19 response, being deployed to the One Health working group for the last few months. And what I'm going to focus on this afternoon is just a talk that discusses some of the One Health aspects and some of the roles of animal animals in the current pandemic. Next slide. So what I'd want to do first is just remind everyone what the accepted US definition of One Health is, which is a collaborative, multi-sectoral, and transdisciplinary approach, working at local, regional, national, and global levels with the goal of achieving optimal health outcomes, recognizing the interconnection between people, animals, plants, and their shared environment. And the reason for this is this really is the core of what the working group has done to address issues within the response and the foundation of all the data and slides I'm going to show you afterwards. Next slide. So the three broad categories of transmission that we think about that involve animals include human to animal, and then animal to human. Next slide. Next, yeah, great. So when we talk, before we can even consider these transmission routes, the first question to ask is, what do we know about susceptibility? And when I think about evidence of susceptibility, it's really in two broad categories. The first being experimental evidence, and the second one being evidence from nature, so natural infection. So this slide provides a really nice broad overview of the wealth of experimental studies that have been done to date. And you'll see this was updated yesterday, but this, along with all the slides I'm going to show you today, are rapidly evolving numbers. And there are a bunch of resources that I'll refer you to. So please, if you want to know the most up-to-date, definitely refer to the original sources. So within this slide, I'm showing you, we like to refer to this as the stoplight slide. So in green are species that have been shown experimentally to be highly susceptible to infection, whereas in the yellow, there are species that we consider moderately susceptible. So either a subset of them developed infection, or if there were transmission components in the studies, there was not evidence of transmission to others from the same species. And in red, finally, are those that did not have evidence of infection in these studies. And what I want you to keep in mind also is that for some of these, if you look in the numbers, it's based on limited studies. So we're constantly monitoring this to see if any of this information changes. Next slide. The next few slides will focus on what we know in nature. And we're months into the pandemic now, so the information that we have available to us is vastly different than what it was back in January. On the global front, what we know is that there is official reports of 71 animals and 54 mink farms from 12 countries. And you can see these encompass a variety of species: cats, dogs, tigers, lions, a puma, and also categories of mink farms in a variety of countries. Of the 71 positive animals, 41 of them are from the US. And I will talk more about that in future slides. Next slide. This is another slide showing the global numbers, but a little bit differently, just to show you the breadth of where this reporting comes from internationally and where we're basing all this data. And once again, just to point out the numbers from the US, and we're going to touch on why those are higher than what we see from other countries. Next slide. So what's important when you look at those numbers is understanding what the case definitions are. And these will vary depending on if it's a global reporting scheme or if it's a national one. So for the OIE case definition, and this is posted online, they have two broad categories: a suspect case and a confirmed case. And the suspect cases are animals that have clinical signs suggestive of disease, that they've ruled out all other causes, and animals that have an epidemiologic link with a confirmed human case or other potential exposure. What makes them a confirmed case, and this can be with or without clinical signs, is that either the virus has been isolated from a sample from the animal, or they have evidence of viral RNA. And that, in order to confirm that, they need at least 2 targets or sequencing that would confirm that it is SARS-CoV-2. Next slide. So the definition in the US, the USDA case definition, is a little bit different, but it falls in line with the OIE posted definition. So here we actually have 3 categories. We have a suspect, presumptive positive, and confirmed. And the suspect case is really animals that have epi-links with human cases. And this really feeds into just the decision-making about whether or not to test them, whether they warrant testing within the pipeline. The important categories are our presumptive positive and our confirmed cases. So presumptive positive cases are animals that test positive by either real-time PCR specific for SARS-CoV-2 or by detection of SARS-CoV-2 antibody. And then to consider them a confirmed case, all this confirmation happens at the National Veterinary Science Lab at USDA, Services Lab at USDA. And this is done by real-time PCR and sequence confirmation, either from the sample or from a virus isolate, or this is where it differs from the OIE definition. They can also be considered a case based on neutralizing antibody alone. Next slide. So the animal numbers for the US, the small table on the right that you're looking at, that's what you'll find if you go to the USDA website. And you'll see that this slide is dated last week and it's already out. It's already out of date from the number of 41. So if anyone's checking my math, they'll see that it's wrong here. And the reason it needs to be updated is there's actually 17 dogs, 17 cats, the 4 tigers, 3 lions, and evidence of infection on 5 mink farms. So once again, always check the numbers. We are updating these weekly. Next slide. So how are we generating this information to really look at transmission events? And there's 2 categories. There is passive surveillance, which is a scenario where an animal comes into a veterinary clinic, they're tested, the testing goes through the pipeline, and then it's reported to local, state, and federal authorities. The other one, active, next slide, is going to be a system where groups, including our own, the One Health Working Group, are initiating active investigations with epi links to human cases and actually conducting surveillance and studies to generate samples and test them to get a sense of what's going on nationally and also potentially internationally. Next slide. So what I wanted to point out is that there's a footnote on the USDA website for many of those reported cases. And this is the language that it says on the footnote. It's samples collected as part of planned and targeted active surveillance of a specific animal with known or suspected exposures to a person with COVID-19 or other exposure to SARS-CoV-2 to better understand risk factors for SARS-CoV transmission. So we have a large number of cases that were identified based on our active surveillance. And that is a predominant contributor to why so many of the numbers globally come from the US. So it would be that, and then also in conjunction that we're calling antibody or virus neutralization positive animals as cases within the US. Next slide. So for the case of the One Health Working Group, we, as I mentioned, we've been a large part of these active surveillance studies. And I wanted to give just a big picture about what we'd consider inclusion at this time for those studies. So some examples of settings we've looked in are household settings where there's a known COVID-19 case, and also in congregate animal settings. Examples would be shelters, potentially could be a zoo or other types of facilities where you have multiple animals that may have been in contact with a handler or someone else in the facility that subsequently went on to have a confirmed COVID-19 case. And what we say is we have interest in animals that have had exposure within 6 feet for greater than 15 minutes. And what we consider an exposure window is contact with either a symptomatic human case, so up to 2 days before their illness onset, and also we consider contact with asymptomatic human cases. And for this, the window would include up to 2 days prior to the test positive sample collection. And the exposure window would extend until the personnel contact ceased prior to them getting their test results and isolating. Next slide. So what are the questions? Why are we doing these studies? There are a lot of things we still have to learn about the role of animals in the outbreak. And we have several questions that we try to address by these active surveillance studies. So the first thing to point out is all these questions are related to animals living in a household or congregate setting where they had close contact with a person with confirmed COVID-19. So we have an epidemiologic link before we begin these investigations. So what we're looking at is what is the incidence of SARS-CoV-2 infection in these animals? If these animals do have evidence of infection, do we have any reported clinical signs associated with that? what is the seroprevalence in companion animals? Are these animals with known exposure? What are risk factors that can be associated either with infection or seroconversion? And then also just looking at testing modalities, so sensitivity and specificity of either PCR and other testing platforms. Next slide. So I'm going to walk you through how a sample goes from collection to then go on to be basically evaluated and confirmed through the current pipeline. So samples are generated by a variety of means. It can be, as again, I said, an animal going in, being brought into a veterinarian. It could be through these active surveillance studies, like the ones I just described being conducted by the One Health Working Group. And it can also be through research studies. There are several universities and other programs nationally that are conducting this type of research. Next slide. When the samples are generated, they go on to what we consider preliminary testing. And there are a variety of means to do that. They can be sent to state agricultural labs, and I will focus on the non-network in a moment. They can also be tested at a series of commercial labs. We're also aware of university labs that are testing. So when the DX, I consider those diagnostic labs. So they could be labs associated with clinical components of universities or vet schools. And then there are also research labs that are doing testing in association with some of their research studies. Next slide. So what I wanted to highlight here was the network of non-labs that are organized through the USDA. It's really a fantastic network that's set up to respond to foreign animal diseases. And this map is highlighting the network of labs that is currently responding to the SARS-CoV-2 outbreak. And it's broken down by labs that are testing animal samples only, both animal and human samples, and interestingly and importantly, labs that are also just testing human samples. So this network has been extremely important even in supporting national efforts for looking at population-based surveys, including students going back to school. So samples can go into this pipeline as part of the testing. Next slide. Another option, as I mentioned, were commercial labs. So here I'm highlighting 4 of the commercial labs that are currently running these tests with links to their information if you want to look at that further. Next slide. So once a sample is tested, goes through preliminary testing, if it comes back positive, then those samples are sent on for confirmatory testing to NVSL at USDA. Next slide. And subsequently, if those samples are further confirmed, then they will be sent on to OIE. The information will be sent on to OIE for international reporting. Next slide. And a really important part of this whole pipeline is the collaboration, once again, emphasizing the One Health network, work between the state public health vets, the state animal health officials, CDC, and also USDA to conduct animal case investigations. And these are initiated at the point where we have a presumptive case, so after the preliminary testing, and that's done while we're awaiting confirmatory testing so that we can implement public health measures as soon as possible and also provide education both locally and also to the households where we may be receiving these reports. Next slide. So now I'm just going to end, we'll go through a few of the transmission chains that I mentioned at the beginning, and then wrap up with some main messages and resources. So the first that I mentioned was human to animal. And this is all I'm going to show about this because we have well-documented evidence of human to animal. All the cases numbers that I've been showing you all have an epidemiologic link to a human case. So we know that this is happening in nature. And we're following it quite closely, and this is why we have both passive and active surveillance systems in place. Next slide. As we go through the transmission dynamics, you'll see that we know less and less. So we know less about animal to animal, but there is some evidence that we can have informed messaging and decision-making based on. So next slide. So this is highlighting some of the experimental evidence. So I mentioned there's studies that are looking at susceptibility, but there are also a number of studies that are starting to look at transmission from animal to animal between species, and namely looking at same species transmission events. So I have 2 papers up here that are looking at transmission between cats and then also one that's looked at deer mice. So they're looking at a variety of species for this. So experimentally, we have shown that animal to animal transmission can occur under these controlled environments where you're also even controlling the interactions between animals. Next slide. But I just want to clarify that for the last slide, remember once again, it's only been looked at for a select number of species. So we're always keeping things in the scope of what's actually been reported and what our current knowledge is. So what about animal to animal transmission in nature? So the main things we're thinking about are in domestic settings, and then once again in these other congregate and in nature also. So the quick answer to about whether this occurs in a domestic setting is it's unclear at this point. We have infection detected in multiple pets within the same household, but those are also households with confirmed human cases. So we don't have the data to show right now whether it was because of interaction with the human case or between animals. But once again, this is something that's being monitored. In other situations, in particular, in some of the international mink farm outbreaks, and I'll highlight a report on the bottom, they have shown and documented animal to animal transmission in these settings. And these are animals that we know are highly susceptible to disease, develop really overt clinical signs post-infection. So we are monitoring this, and it is a very rapidly changing environment, but that's where we stand, and we're doing a lot of work to try and answer these questions moving forward. Next slide. So animal to human transmission, this is really the one that I'm sure will generate a lot of questions and discussion, but this is, of course, the one we know that we're still learning the most about, and that there is the least amount of evidence to support. As Casey emphasized at the beginning of the ZOHU call, it is human to human transmission that is the contributor to the pandemic right now. However, it's very important that we monitor whether there are other contributors or events that are occurring. Next slide. So I'm just going to talk about one aspect where it was presented that there may be plausible transmission to a human. And once again, this was in mink investigations overseas. So this was in farmed mink in the Netherlands, where they had documented transmission from a human case into the mink farm. But then there was also detection of other animals on the farm that were positive or had evidence of infection. And it was suggested that there may have been transmission between the mink and other workers on the farm. But of course, we're still waiting for this to be confirmed, and we're monitoring the situation. Next slide. So as we're thinking about all these transmission dynamics and how to better answer these questions, I just wanted to speak briefly on tools that we have available to us. And one of them is molecular genomics, which is an incredibly powerful tool and has been used in multiple recent outbreaks, including the SARS-CoV-2 current outbreak. So this is just highlighting how we can use genomic material and look at very small changes in the viral genome to try and identify transmission events and also chains of transmission. But to keep in mind, to do this well, you need a lot of information, especially when there's very few changes in the genome. So to be able to generate these reports, it's based on community sequences, it's based on case sequences, it's based on any animals that may be involved. But this is something that both the One Health Working Group and many other groups are looking at to be able to answer transmission questions that evolve between animals and humans. Next slide. So this almost last slide of data was showing where this powerful tool was used in a investigation in the US at the Bronx Zoo. And I heard that this group of investigators will actually be featured on a ZOHU call in the future. So I'll speak briefly, and then please join again to hear their whole story, because it's really fantastic work. This was an outbreak where infection was detected in a group of tigers and also in a group of lions. And what they were able to do, if you can look on the right, is actually determine that the introduction to the lions and tigers were two separate events. And they were able to link up a tiger sequence to actually one of the human cases, one of the tiger keepers. So really interesting, powerful tools that we can use in the future. Next slide. So the take-home messages are that we're using a One Health approach. We're actively monitoring and investigating SARS-CoV-2 transmission dynamics between humans and animals. At this time, there's no evidence that animals play a significant role in spreading the virus. And based on the limited information to date, the risk of animals spreading COVID-19 to people is considered to be low. However, it's important that we keep monitoring these, and more studies are needed to understand if and how different animals could be affected by COVID-19 in nature. And once again, using these advanced tools, we'll be able to answer those questions in a very powerful and robust way. Next slide. So this is a long list of resources for everyone on the call to refer to. And I really invite you all to visit the CDC websites we have available for pets and animals and COVID-19. There's a lot of really great information that is updated regularly. Next slide. So with that, I'll thank everyone for your time and open it up. I guess it's going to be a general question session. Thank you.
Thank you, and thanks to all of today's speakers for their informative presentations. We do have several questions for each of our presenters. So I will start with Dr. Gleason. There's a question, is there a mobile app available for NORS or ACOSS?
There is not, but thank you for the idea, should new money come in.
Yeah, and one more question for you. Does NORS include local state? It includes local, state, and territorial health departments. Does it include tribal as well?
So NORS is open to tribal health departments. We don't currently have any active users from a tribal health department. Reporting through NORS is voluntary, and we do currently have all 50 states represented, but each state has different resources available to dedicate to NORS, so it can vary how much time they're able to contribute and how complete the reporting may be.
Thanks. And there are a couple more for you. Is there any plan to delineate occupational related animal contact outbreaks from visitor outbreaks in the NORS dashboard or future ACOSS reports?
There are plans actually. Currently, the data collection tool that we have does not capture information on occupation, but we revised our form this past year and are in the process of getting it released. So in 2021, the new form should be released that does address this question. So we will be able to capture data on occupation for animal contact outbreaks.
Thank you. And then one more, does the outbreak associated with poultry include backyard coops?
So within the NORS dashboard, we only have a small subset of the variables available that we collect for ACOSS. And so that would not be readily available through the dashboard, but you can request a full data set from our team, and we can get information on that based on the setting reported. Again, for our upcoming revision, this information will actually be even easier to look at, because when we revised our form, we added specific questions to capture this information more systematically and accurately. So right now it's possible to get, but it takes a little bit of digging, but hopefully by next year it will be easier to get at.
Thank you for answering those questions. And the next few questions are for Rita. Is there any consideration to make rat bite fever a reportable disease?
Reportability is actually at the state or jurisdiction level, but there are no plans to make it a notifiable condition either. And I have a feeling states will not be adding it as a reportable condition.
Okay, one more, is prophylaxis recommended for rat bites?
This is a complicated question. We don't have any direct recommendations for or against prophylaxis at CDC. I think the data are just pretty sparse. The recommendation in some places, including the Red Book, that prophylaxis could be recommended is based on some kind of old data that's pretty biased, that 10% of bites lead to rat bite fever. We found, our study found that really doesn't hold up, that we found 0.3% of rat bite injuries in ED visits also had a rat bite fever diagnosis. So I think this is really in the clinician's field that they need to make a determination if the case or if the individual has additional risk factors for potentially like immunocompromised conditions or anything else that would predispose them to an infection. Sorry, that's not a better answer.
Thank you. There is one more for you. Do rat bite fever patients show reactivity on Rocky Mountain spotted fever serologic tests?
I'm not that familiar with serological tests that are available for rat bite fever. However, the two diseases are pretty different phylogenetically, the etiologic agents at least, but also even if they are confused, doxycycline works for both. And so we've actually have some recommendations out there that doxy could be used when still waiting on test results to differentiate the two.
Okay, thank you. The next question is for Dr. Spengler. Are ferrets able to be infected with SARS-CoV-2 experimentally?
Yeah, there's several reports that have presented data on ferrets. So, and I'm happy to provide links to whoever would want them. But yes, there is definite evidence that they are quite susceptible and they do develop clinical disease post-infection.
Thank you. There's another question for you, Dr. Spengler. Do we know how many dogs and cats in the US have been tested for SARS-CoV-2?
Yeah, that's one of those great questions. It's been a huge push from all the governmental partners to assess the denominator. And we do have, ideas of what that would be, but it's something we're still determining. So like I can give you a number now, but as far as what that may translate to as we're still trying to gather all the denominator information, I'd prefer to kind of wait until we have concrete data for that. But that's a very good question and something that is being looked into because it's hard to really interpret the data and interpret how many animals have clinical signs or don't if we don't have a good denominator. So thank you for asking.
Great. And then have there been any reports of domestic cattle or goats acquiring SARS-CoV-2 from human contact?
No, not to my knowledge. None of those species have been reported.
Thank you. We did have another question for Rita. Do you have information on breakdown of RBF by pet, laboratory, or wild rodent?
Hi, thanks. No, unfortunately we don't. That would be great.
Okay. Let's see. This one's for Dr. Spengler. Is there any concern that the virus can cross back into bat populations?
We don't have evidence of that right now. There are active studies in many bat species. There was a study, people are looking both nationally and internationally, but nothing suggesting that that can happen at this time, no.
Okay, thank you. We are coming to the top of the hour. If you have other questions for today's presenters, we've included their email addresses on this slide on the ZOHU call webpage for today's webinar and in today's email newsletter. And also, I wanted to let you know that the Bronx Zoo Big Cats presentation is scheduled for October 7th. So hopefully you'll be able to make that very interesting presentation. And that ends today's call. Thank you for your participation.